what I wanted to do today was sort of put a little bit of a context on, let me move this forward here, a little bit about what healthcare reform means for the small business community. We know that there's a lot of questions out there about what exactly healthcare reform meant. We've been hearing about it for the past 2 years, but we're getting to the point now where the law is moving towards full implementation, and so there's a lot of immediate questions for small business owners. The goal of what I plan to do today is hopefully sort of outline a little bit about why the Affordable Care Act, or you might hear us refer to it when we're up here on stage, call it the ACA. Most of you probably know it well as Obamacare. We're going to talk a little bit about, why was Obamacare passed, what was the intention behind it, and then drill down a little bit on sort of the national scope about what it means for small business. And then we'll have a wonderful panel today who I think will dissect a little bit more about what exactly it means for you, and we're also looking forward to taking your questions. So a little bit about us and who we are. We're a small business advocacy organization, as Ryan said. We're national, but we have offices all across the country, including here in Missouri, where we work to educate small business owners every day about what's in the healthcare law. We do a lot of research and advocacy, and the reason that is important is because the vast majority of the public policy issues we work on are the key issues for small business owners. And I'm going to talk a little bit about sort of some of our healthcare research and why we decided to get involved with healthcare and healthcare reform. And the biggest reason for that was because we really saw it in all of our opinion surveys as sort of the number one issue that small businesses were dealing with. And then we're very focused on outreach and education. And so part of what we do here in our Missouri office is Mary Timmel, who I don't think is actually in the room, but is standing out at the table. Oh, Mary's in the back. Mary, wave. Mary actually is our staff person here in Missouri, and we actually just brought 2 new people on board who travel around the state and talk to business owners like yourselves. We go into Rotary clubs, Kiwanis clubs, and we talk to folks about what's in the healthcare law. So let's go back before healthcare reform was passed and sort of remember the situation that we were in. One of the biggest things we heard out of all of our opinion polling was that small business owners really struggled with costs. You can see here that 25% of small business owners are uninsured. That's according to a 2012 study done by the Kaiser Family Foundation, which is a leading public policy organization which looks at these issues. And then 28% of the self-employed community are not covered. Why is this important? Well, according to the US Small Business Administration, there's 28 million small businesses in our country. 22 million of those are self-employed. So again, I'll repeat the numbers. 28 million small business owners in the country. 22 million of them are self-employed. So when we talk about 30% of them not having access to health insurance, that's a huge part of the population. And then also we know that small firms in general pay about 18 to 20% more than larger firms. And we're going to talk about what the healthcare law does specifically to sort of try to get at that piece. We were very interested in what exactly was the economic data behind the reasoning for healthcare reform. We worked with MIT economist Jonathan Gruber. Some of you may know him. He was an advisor to Governor Romney when Massachusetts was talking about healthcare reform. I also worked very closely with him when I worked for Governor Schwarzenegger in California when we were talking about healthcare reform in California. And Jonathan Gruber did a study for us looking at what were the small business impact. And if nothing was done before healthcare reform, we saw that cost would have more than doubled in 2018 to about $2.4 trillion. And all of these studies are on our website, and I'm going to give you information about that. In general, we also know from our opinion polling that one of the biggest reasons that small business owners don't get coverage is generally because of the fact that they can't afford it. And you can see here that there's a myriad of issues, but clearly the affordability issue is sort of the underlying issue why small business owners who've wanted to get coverage, when you talk to small business owners, generally they want to provide coverage for themselves and often their employees, but the biggest barrier is often affordability. And you can see that small business owners who currently offer coverage, it's not just a problem for those who don't have it, but even those who currently offer coverage are really struggling to do so. So let's take the basic components of the Affordable Care Act. It's important to know that the ACA builds upon our existing healthcare system. And it really begins the process on a macro scale of beginning to rein in costs. And I'm going to talk a little bit more about what that means throughout the presentation. As many of you know, the law went to the Supreme Court, challenging the constitutionality of the law. The US Supreme Court upheld the law. And implementation is primarily the responsibility of the states. I'm going to drill down into a little bit what this means as we go on through the presentation. As we know, the federal government is working in partnership here in Missouri. However, several states have decided to go out on their own and implement the law through their state governments. The real reason for this is because what works in California doesn't work in Missouri, what works in Missouri doesn't work in Oregon. And so the law, when it was created, it tried to create flexibility for the states to really be able to make sure that it works for each state in its unique home. And then also, there's some important benefits of the law that went into effect immediately. Many of you may have heard about these or may not have heard about these in the media. I'm going to quickly run through those. And then this law actually phased in over time. So when the law was passed, some things started right away, but what we're starting to see now is we're really starting to move towards full implementation. But the reality is a lot of components of the law still don't kick in for the future. And so we're seeing a phased implementation. This is a lot of change to the way in which people access health insurance. And so it was something that, in order to not create too much shock in the system, has been phased in over a number of years. So what are some of the most important sort of consumer protections that are in the law? A lot of you folks may be familiar with these. These are the most popular provisions of the law that are talked about pretty frequently. The first, insurers will no longer be able to deny coverage for patients with pre-existing conditions. This is a pretty substantial change. There's estimates out there that 50% of Americans identify that they have some sort of pre-existing condition. So the fact that insurers will no longer be able to deny coverage if you have a pre-existing condition is a big change to the way that things were before. It also banned lifetime caps. We would often hear terrible stories about individuals who would get sick, or often they would get very ill, particularly with a life disease like cancer, and insurance companies would often dump a patient because of the cost of the insurance policy. That is now illegal under the Affordable Care Act. And then also adult children can stay on their parents' plan until 26. If this is an option that works for your adult children who may have struggled to get coverage, it's an option for parents. Some parents have decided that this isn't the best option, but it's an option if you want them off your couch, right? This is an option that's available to you. Some other important things. Health plans can't drop coverage when someone gets sick or if they made a mistake on their paperwork. We heard a lot about this during the debate around the healthcare law for folks who had made a simple error on their paperwork and then their insurance coverage had been dropped. This is now illegal. First dollar coverage for preventative care. One of the big things the ACA does is it starts getting cost going, it starts dealing with cost through prevention. And we know that the earlier we can catch things, particularly in the healthcare space, the more money that we can save in the long run. And so there's a shift in the way that money is spent, particularly in medical systems, to start focusing more on prevention and wellness. And then there's increased access to care. And so there was an infusion of money in the law that went to community health centers, which quite frankly serve our most vulnerable populations across the country, and in addition provided increased access for those folks. So what are the key provisions for small business? There's a few, really three big provisions, and then I'm going to talk a little bit about a term that you may have heard us use called job lock. One of the biggest provisions is that there are immediate tax credits in the law for small business. I'm going to break down the tax credit a little bit more for you. The second is the pre-existing condition insurance plan. One of the biggest challenges we saw, particularly for the self-employed population, which I talked about before, was that if you had a pre-existing condition, you weren't able to get insurance. And since the new marketplaces, which we're going to talk about in depth coming forward, didn't come online until 2014, what were these self-employed folks supposed to do? This was really created as a bridge program, the pre-existing condition insurance program. Some of you may have been beneficiaries of this program. And then lastly, it establishes a competitive marketplace for small business and the self-employed. The small business marketplace you may hear it referred to as the shop. I'm going to talk a little bit more about what that is. And then there's an individual marketplace for individuals, which is an important component of this, particularly for the self-employed entrepreneurship community. One of the biggest parts of the ACA and one of the biggest phenomenons we saw when we were looking at healthcare reform was this whole idea of job lock. And the idea was that there are tons of entrepreneurs out there who had a great idea. They wanted to go out, they wanted to start a business, they wanted to become small business owners, but they weren't able to because they weren't able to get access to coverage. Some folks are able to do it because they have a spouse or partner who has access to coverage, and so they were able to get on their plan. But if they were single or they had some sort of pre-existing condition, they weren't able to do that before, and this is known as sort of the term job lock. And one of the biggest things that the ACA or the healthcare law does is that it opens up these marketplaces And it allows folks to get insurance for the first time through these marketplaces, as well as they are not prevented if they have a pre-existing condition. And what this does is it allows several folks who've wanted to go out, be entrepreneurs, and start their own small business to do so. So one of the biggest benefits that we've seen from this law, the Robert Wood Johnson Foundation, which is a large healthcare foundation, actually did a report looking at what was the impact of job lock. And we saw that there's a large amount of people around the country who've actually wanted to go out and start their own businesses, and that the healthcare law for the first time may allow them the ability to do that because they're able to get insurance for the first time. So let me begin by drilling a little bit down on the tax credits, and we're going to get a little bit more into this in the panel, but I wanted to provide sort of the basic framework for what the tax credit and what it looks like. First important thing to know is that the tax credit's available to businesses who have employees. So unfortunately, the tax credit, in this case, we're talking about the small business tax credit, is not available for self-employed entrepreneurs, although there are other tax credits that they may benefit from. It's available now. The tax credit actually took effect in 2010, and one of the biggest things that we see is that a lot of folks actually don't know about the tax credit. We've heard from a lot of small business owners that they don't know about it. Accountants are now really getting up to speed. A lot of accountants now know more about the tax credit, but really when the law was first passed in 2010, a lot of folks didn't even know that the small business tax credit was in place. Which businesses are eligible? There's generally 3 basic criteria, and the tax credit does work on a sliding scale, which we'll talk a little bit about. First, it's important to know that it's fewer than 25 full-time employees. The vast majority of small businesses in our country are actually 10 employees and under, so that does actually capture the vast majority of small businesses in the country. Average annual wages for the firm, which actually don't include the employer's salary, have to be under $50,000, and that the employer, if they're offering coverage, must pay at least 50% of the premium cost. So we were very interested. Well, okay, how many folks actually qualify for this tax credit? We went out and we did a report, and the report actually showed us that about 85,000 Missouri small businesses qualify for some portion of the tax credit. You can see here that that's about 92% of small businesses are in that eligibility range, which is why we've been doing a lot of education about the tax credit and trying to get the word out about it. The tax credits work on a sliding scale. So from the years 2010 to 2013, it covered 35% of the premium cost. In 2014, that actually goes up to 50%. The important thing to know here is that in order to access the tax credit in 2014, small employers actually have to purchase coverage through the small business marketplace, which I'm going to talk a little bit more about moving forward. The tax credit, in terms of talking about premium expenses, you can see here that's comprehensive medical coverage, including dental, vision, and long-term care. And the tax credits actually do not cover premium expenses of owners in the family. So this is very focused on the employer's employees that are not relatives. And actually, when you're figuring out the average annual wage of salaries across your company, you do not take into effect the owner of the business's salary, which happens generally to make sort of the highest salary range, which allows more flexibility generally to get into that average of the 50,000 range. And then it's important to know that you can actually amend your tax credit for past years. So if you think that you benefited from the tax credit from 2010 to 2013, and you're just learning about it today, and you benefit potentially from the tax credit, you can actually go back on your taxes and take advantage of the tax credit. The tax credits are also available for nonprofits. We hear a lot about, well, are nonprofits considered small businesses? Yes, they are, and they actually benefit from the tax credit. The tax credit, as you know, since nonprofits are not liable for taxes, most are 501c3 organizations, the tax credit is a little bit different. The sliding scale works a little bit different. It's up to 25% for 2010 to 2013, and then 35% for any 2 years in 2014. And so it's important to know that for folks who do decide to take the tax credit in the exchange, they can use it for any 2 years of their choosing, up to 10 years starting in 2014. So there is some flexibility in the tax credit in terms of how you might want to use it depending on what your tax situation and your tax liability is for the year. For nonprofits, you include the amount on line 44F of the 990T, which is a pretty standard tax form for most nonprofits. It's important to know that it does not have to be publicly reported, and this is a refund for tax-exempt employers. And then we give some information, and we will, I believe, be making all these slides available to everyone in the audience audience because I know that there's a lot of information and I see folks scribbling down notes, but we'll make sure to make these available. So let me just sort of break down. This is sort of a generic example. We have heard from small business owners who benefit from the tax credit here in Missouri, but I always like to give an example. In this example, this is a restaurant with about 40 part-time employees. If you sort of do some easy math, say that's 20 full-time equivalent workers. If wages are about $500K, healthcare costs about $240K. You can see here that you can get about, from 2010 to 2013, that could have been about a $30,000 tax credit, and that you see in 2014, if the small business owner was to purchase inside the small business marketplace, they could potentially benefit from a tax credit there as well. That would actually go up. So how exactly do small employers take advantage of the tax credit? First, use Form 8941, which is obviously available on the website. Most small employers have an accountant, and if you have an accountant, obviously that's the best place to have this conversation. As I said before, it can be reflected in determining estimated tax payments, so you do have some flexibility with the tax credit. And it's just important to know that this actually applies towards income tax and not towards employment. So getting to sort of the third sort of component of the law that I talked about, there were three big components for small business, the marketplaces. And as I said before, we often refer to this as the SHOP, so the Small Business Health Options Program, and so that's what SHOP is short for. The idea behind the SHOP is creating a new large marketplace where small business owners can band together and use economies of scale. One of the big advantages that large businesses have had over small businesses for years is that generally they self-insure, they have many more employees who work for them, and so they're able to handle risk in a different way. For small employers, it's really been a challenge in the past because if one of your employees gets sick, it can often really sort of jack up premiums if one of your employees gets sick. And so the idea behind the marketplace is allowing small business owners to be in an insurance pool together. It's private insurance plans who compete inside these marketplaces, and this is particularly focused on small business with 50 employees. There is conversation that eventually the SHOP can open up, but for the first few years, small businesses with fewer than 50 employees would benefit from the SHOP. Enrollment actually has already begun on October 1. I'm going to talk a little bit about sort of what that means and what the options are. And then coverage here would benefit starting January 1. It's important to know that the SHOP or these marketplaces are sort of the key vehicle by which we see coverage being extended to folks. You can see here in a study that was done by RAND that the marketplace is the key vehicle for expanding coverage up to about 86% in the small group market, where it was, before healthcare reform, about 60%. And that's an increase of about 10.5 million workers nationally. So what exactly is the small business marketplace supposed to look like? The idea is that it's a one-stop shop web portal. A lot of folks have compared it to Kayak or Expedia. Maybe a tax accounting web-based platform might be more of an ideal sort of comparison in that regard. The idea is that you'd be able to look at the different plans that are available to you as a small employer. You'd be able to look at price, the quality, what are the different services that are offered to you and also your employees for the plan that you're potentially picking. And the idea is to have the system tiered into four big components. The lowest level being bronze, the second level being silver, the third being gold, and platinum, ranging from the level that the employer would like to make the contribution, sort of the highest level being the least out-of-pocket expenses with the highest level of benefits, and the lowest level being with sort of a higher level out-of-pocket but with a lower level of benefits, but all sort of having a basic framework within these four categories. There would be a calculator to compare plans across different plans and see what the different options are. And one of the biggest benefits that we hear that is often really liked by small business is the streamlining of the billing process. The idea that small employers just have to cut one check to the exchange, and it simplifies a lot of the administrative efficiency for them. As we know, small business owners are busy doing what they do, whether they run a bookstore, which we're going to hear from later, or they run a sandwich shop. They're busy doing whatever they do, and sort of the process of health insurance can be complicated. So the state health insurance marketplaces, small business workers and self-employed can benefit from affordability tax credits that are available in the law that allow them to make coverage more affordable. One of the other things that the exchange does is that it ensures more money actually goes to medical care. This sort of begins the process of what we were talking about before in terms of investing in healthcare in a different way. The exchange sort of begins that process here as we talk about the ACA being, or the healthcare law being implemented. It also, as we talked about before, there's an incentive here for administrative efficiency. It modernizes the system in the way that small businesses do things. And then lastly, quite frankly, it reduces a hidden tax that a lot of folks end up paying for folks who utilize the emergency rooms, who go in who don't have health insurance. By extending coverage to these folks, they'll have health insurance, and the hidden tax that you and I pay for folks who don't currently have insurance is now taken away because folks are able to access healthcare through having affordable coverage. So what exactly do we have in Missouri? And I know the panel is going to break down a little bit more into this specifically, and my role is really more to give a national overview. We saw that 2 carriers have joined the insurance marketplace, specifically on the small business side. It's Anthem Blue Cross Blue Shield and Blue Cross Blue Shield of Kansas City. And what we've done here is, at least for the St. Louis City and St. Charles County and St. Louis County, we see right now that there's essentially 3 plans in the exchange. And what we did is we just took a 27-year-old so that you could see sort of the pricing that was available. Obviously, age, the plans differ by age, but you can see here for a 27-year-old in the bronze category, it's about $201.61, and then you can see as you move up the benefit scale, sort of the difference at pricing, moving up to gold, which ends at about $285.01, and we actually see consistency across the county. We're going to talk a little bit more about this. I know the panel is going to dive into a little bit more of the details around this piece. On the individual marketplace, so for the individual side, so for folks self-employed who decide to go in on their own, we see that there's 3 carriers available. You can see them over here, including Coventry. And then also we included on the side, you can see on the city that there's approximately 25 choices available. And you can see here what the plans are for a basic 27-year-old who chooses bronze, which is at the most basic level. So one of the last pieces that I wanted to talk about, and I'm getting to the wrap up here so that we can get to the panel and we can get into discussion, is the employee shared responsibility requirements. We get a lot of questions from small business owners. We've heard a lot in the media that there's requirements for small business people. One of the most important things to know is that if you're a small business with 50 employees or fewer, you have absolutely no requirement to offer insurance. And that is the vast majority of small businesses in the country. That is 96% of small businesses and under. So I'll say it again, if you have 50 full-time employees or fewer, you have absolutely no responsibility to offer healthcare insurance. However, the law does provide new opportunities for you to do so, and we're seeing more and more employers who are interested with the tax credits and with the marketplaces in doing so. But I think that there's sort of been a lot of misinformation out there about what exactly this means. We're going to talk a little bit about further in the panel about how do you calculate your full-time employees so that you know what exactly this means for businesses who may be close to that range. But the largest block of employees in the country are really the 10 employees and under population. So most small businesses really aren't even sort of getting close to this edge. So for large employers, it's important to ask, are you above or below that 50 threshold? Because obviously that determines what your options are. And how exactly is a full-time employee decided? This is a change in the law that's really important. Full-time employees are actually folks who work at least 30 hours full-time a week. So it's different. A lot of folks are used to using the 38.5. Under the healthcare law's estimation, you're looking at 30 hours per week. For part-time employees, it's 15 hours per week. And then we get a lot of questions about seasonal employees. So I run a seasonal business where we bring folks on for a few months, or we run a ski lodge, or anything like that. Seasonal employees for folks who work under 120 days a year, or just at about 120 days. Size is actually determined annually, so when they look, when the IRS looks at your small business to determine what is your size, they look at it from an annual perspective. And then in terms of whether there could be any fees assessed, and I'm going to get a little bit more about that in the next slide, that's actually determined by your monthly employee count. All right. So potential requirements for large employers. So it's important to know, as I said before, this only applies to employers who have above 50 full-time employees. And so what exactly it is, if you decide not to offer coverage, if you have above 50 full-time employees, there is a penalty that is assessed for small business through the IRS. What it is it's $2,000 for each full-time employee, but that is actually minus the first 30 employees. And so I know that that sounds like a complicated equation, but what it is it's essentially on those 20 or above. And so what they do is they take out the first 30. And then also, it's really important to know that the coverage that you offer has to also be affordable, which means that it can't be more than 9.5% of your employees' income. And we're going to talk a little bit more about that too in the panel. And so you not only have to be able to offer coverage if you have above 50 full-time employees, but it's also really important that you offer a coverage that is affordable to the employees. And so making sure that you meet that value is a really key important part of if you're going to offer a plan. What's important to know is that all of the plans within the marketplace actually meet these requirements so that you know if you purchase a plan in the insurance marketplace, you will be able to know that you meet those requirements. You're still able to offer your plans outside the marketplace if you'd like to do that, if you have a plan that currently works, as long as it meets these requirements. So what now for individuals and the self-employed? Well, the individuals, which is a little bit different than for small businesses, they'll take advantage of the individual marketplace. They'll be able to purchase plans that'll be organized by the same metal level, so they'll still have the varying options. As I said before, bronze will have the lower premiums with higher out-of-pocket costs, and platinum will have higher premiums with lower out-of-pocket cost, so greater value on the platinum level. And what's important to know is that all of these plans, both within inside the small business marketplace and the individual marketplace, have what's called the essential benefits package, which are a package of services that are now required under the ACA, which include things like ambulatory services, women's visits, women's health benefits for women, and different benefits that we can talk a little bit more about in the panel. So a little bit more on the employee shared responsibility requirement. Actually, we did that slide. We must have went back. Okay, so employee notifications. This is one important piece of the healthcare law that's really important to know, and it's something that is required for employers that a lot of employers have missed. So starting in October 1, employers were actually required to send out an employee notification to employees about their new options under the marketplaces. The form is an easy downloadable form here at the DOL website, and like I said, we'll get this information out to folks. This was actually required for employers to do October 1. If you haven't done it, don't panic, because there's no fees assessed at all with actually doing this. What we're suggesting to employers is to go on, download the form, make sure that your employees can get it. There's actually, they've suggested that folks either mail it to their employees, or if you want to hand it out to your employees and have some sort of form where they can sign that they've received the form, that is probably the best way to do it. All you have to do is download the form off the website. What this form does is it essentially notifies the employees of their new options under the healthcare law, and so that they know about the marketplaces that are available. This is particularly important for small employers who don't offer coverage, so that the employees who can benefit from the new healthcare law can know what their new options are. So what's next? As I said before, we know that the marketplaces, you've probably been reading a lot about them in the news, and we're going to have a conversation about them. They open October 1. It's really important to know that the small business portal won't be live on the online website, even though you can get on and you can actually look at costs on the website. You actually won't be able to purchase insurance through the federal website until November, and so that's something that's really important. However, you can still get insurance now if that's something you're interested in, because there is an option to call in, as well as there's all sorts of options through navigator programs and brokers, which we're going to talk a little bit more about. January 1st is when coverage begins, and then you can see here that March 31st is the end of the open enrollment period. And some of you may have saw just recently in the news, one of the things that they did was they actually are going to use that full open enrollment period and give that space to everyone, so no one would actually be assessed any fines as long as they have that full period to go ahead and enroll into coverage. So for small employers, important dates for you to know is October 1 with the employee notification that we just talked about before. And then it's also important to know that small employers have an advantage that individuals don't, which is that they can enroll in the shop on a rolling month basis. So it actually doesn't end after March 2014. So we're hearing a lot about the enrollment period on the individual marketplace side, which is that if individuals are going to purchase insurance, they have to do so before the end of March. That is correct. But for small employers who decide that they want to take advantage of getting coverage through the small business marketplace, they actually are able to do so on a rolling basis, which is different. So what are some resources for business owners? Because I know that was a lot of information. The first is we've actually launched a website that is available for you all on our website, www.smallbusinessmajority.org, where we have all of the information I went over today, including what are small business owners' enrollment options. And then second, of course, is the famous website, which I'm sure you've heard a lot about in the news, which is healthcare.gov, which does have quite a substantial bit of information for small employers, and it's also where small employers would turn to in November if they decide that they wanted to purchase coverage on their own through the small business marketplace. So as I talked about before, healthcare.gov is a website. There's the address to our Missouri website for folks who are interested, and I have our website on here as well, smallbusinessmajority.org. Just a few resources that we have. We have a one-pager, What's in the Healthcare Law for Small Business, which summarizes all of the things I talked about today in a very pretty one-pager. We also have a detailed frequently asked questions.